Hi out there. My name is Amy. I'm 27 years old and I suffer from a disease called Cyclic Vomiting Syndrome, or CVS for short. I made a video that sort of touches on this subject in the past, though I didn't go into too great of detail. And due to the overwhelming amount of interest and support that I've received because of that video, I was inspired to make a part 2 to hopefully raise a little bit of awareness, that is, um, of this particular side effect of CVS that, to my understanding, a lot of other people, other than just me out there, either are suffering from or going through now, or I've gone through in the past. And this is really kind of embarrassing for me to do on camera and on the internet, but for the sake of the cause, I suppose I will. But this is what CVS has done to my teeth, or lack thereof, I suppose. Excuse me. I apologize. I know it's probably a bit gross, maybe, or hard to understand. If you couldn't understand what I was saying, I said this is what CVS has done to my teeth, or lack thereof. First of all, if anyone out there is watching this video who doesn't know what CVS is, just a quick summary. It's a disease that not many people know about, which makes it that much more frustrating. It's prevalent in a lot of times in children, but also in adults. Basically what it is it's recurring episodes of extreme nausea and vomiting that usually tend to follow some kind of a cycle. For me, mine is triggered by my menstrual cycle. So every month I get these horrible attacks of just the most intense and excruciating nausea you've ever experienced, and just vomiting that just won't quit. And this vomiting, it's not like, oh, I got the flu, I'm not feeling good, I'm gonna, just throw up a little and sit there in bed, or oh, I drank too much last night, I've got a wicked hangover and I'm gonna throw up and then go, eat some McDonald's and I'll feel better. It's almost like, for me at least, you feel nauseous, and once the vomiting starts, it will not stop. I mean, for me, it just won't. There's nothing I can do that stops it, other short of going to the hospital. And it's almost, the way I explain it is like my stomach is trying to turn itself inside out. Like after a while, it's not even like vomiting anymore. It's just like these spasms, and just like I'm really bad at explaining this, but you'll vomit and vomit to the point where you're just vomiting up these horrible stomach acids that just burn and tear up your esophagus. By the end of it, there's a lot of just retching involved. It's not, just like productive vomiting. After a while, it's just retching and making horrible sounds, and all that'll come up is this bit of yellow, or even like that green, just deep down stomach acid. And for me, a lot of times, even just blood, from how much, it's tearing at my esophagus. And no matter even how empty your stomach is, there's just no stopping it. It's like, for me, I can't speak for other people, I just keep vomiting, and almost every time an episode starts, I end up in the hospital, and I just have to be given every antiemetic that they have, and given even be slightly sedated, because otherwise there's just no way that my body will relax enough for me to stop having this, this vomiting. Anyway, so that's basically what CVS is. And having gone through that, every month, my teeth were beautiful not long ago. Just within a matter of years ago, I had a beautiful, perfect smile. And then the CVS got really bad, and it was just like I started seeing decay begin, or the decay started just right, like on my gum line, and I noticed these areas that were like black, kind of right along the gum line of my teeth. And I've got great oral hygiene. I really do. I brushed my teeth too much, actually, and that was what what I hear could be part of the problem. For a long time after I would vomit, it's really gross. Nobody likes to do it. I would brush my teeth. Forgive me, my phone's going off. I would brush my teeth immediately after vomiting because it's gross. Who wants puke taste in their mouth? And I did that for years, and it turns out that that's the worst possible thing you can do because the stomach acids in your vomit can soften the enamel on your teeth. And if you brush immediately after while the enamel's still soft, it can sort of brush it away. And I didn't know that. I felt kind of stupid when, my teeth were almost falling out, and I learned about that for the first time. But anyway, so yeah, I've got good oral hygiene, but I just started to notice this decay forming, and it's like right after I noticed it start every day, I could almost see it get worse, and it would progress further down my teeth. Then all of a sudden, a chunk of this one, it fell off. Other ones fell off. Some of them would just, and it's not like they fell out like a normal tooth, like the tooth came out. It's like they just crumble, and like chunk by piece by piece, and several of them just broke apart until there was nothing. I still had the root tip stuck in my gums. It's horrible, and they just fell apart. One time I was at a bar with some friends. I took a bite of a chicken strip tooth right in the front here. It broke off. I was mortified. It's horrible, and it really is. And there's already not a whole lot of awareness. I'm sorry, you have to forgive me. My teeth are kind of loose because I had to be able to pull them out there easily for dramatic effect. But anyway, there's already there's not a whole lot of awareness around about CVS, and a lot of CVS sufferers have to deal with being treated poorly when going to the hospital, being treated like drug seekers, or being treated like they're making it up, or they're doing it for attention, just because there's no actual tests that can be done, to prove. It's not like they can do a blood test to say, oh, you have CVS. It's more like a process of elimination, and just requires, review of your medical records, by somebody who understands the disease to be able to diagnose it. Anyway, I'm sorry. I was really hoping this video would be a bit more focused than it's turning out to be. But it's hard enough to have CVS, knowing that not many people out there know about it. I feel like a lot of times people they listen to what I have to say about it, but I can tell in my head that they're thinking that I'm just using it as an excuse. Oh, why is she sick all the time? Why is she vomiting all the time? Like I know for a fact that people have thought that I used my CVS as an excuse to hide a drinking problem, or I just have a really poor diet, which my diet's not the best, but it's not that bad. And yes, I drink from time to time, but it's not the same thing. Or I've also, it's hard enough to just suffer and know that you're being judged because of this disease, and then to have something like, your teeth start falling out. And if you ever try to explain that to somebody that it's because of the CVS, it's like you're just being judged even more. Like I know that people, when I told them about it, just kind of, yeah, that CVS is an excuse for everything, but it's true, and it's really hard to come forward about because it's embarrassing. And I've suffered from this disease for years, and I've never seen, I may have seen an article or two here or there about how the CVS can cause tooth decay, but it's not talked about much. And I know how hard that must be for people out there who are still going through it. I've wanted dentures for years. Everybody told me it was a horrible idea. You're too young. You're going to regret it. Blah, blah, blah. Best decision I ever made. I'm so happy with mine. I got my smile back, and I've got teeth again, and they're nice, and I can smile, and I feel like a new person. I'm not trying to brag about myself here, though. I really just want to reach out to anybody else out there who is going through what I've gone through. And I know the shame you feel. I know how hard it is just to come out about CVS in the first place, knowing that, it's not very well understood. And I know how much harder it is to come out about something like your teeth. Me myself, I know that I've been judged by people as thinking I was a drug addict or I had meth mouth or something like that, and that's not the case. And it's horrible. It's mortifying and it's embarrassing. And you're not alone. That's all I want to say is you're not alone. I know my stupid little videos here, just rambling on, talking about stuff, are not enough to make it to bring awareness to this. But I really hope that somehow, um, at least some awareness can be brought to this side effect, because these people should not have to feel alone because of what they're going through. It's not your fault. For a long time, I thought it was me. Something had to do with me because I didn't see anything related to CVS anywhere talking about this, horrible side effect of it. Until recently, until I put myself out there with my first video, and I just got an overwhelming response. And so, this video is just to hopefully maybe together we can all try to bring some more awareness to this, so nobody has to go through those horrible feelings of shame and just feeling alone that I've gone through, and I know so many of you out there are going through right now. To anyone out there who's suffering through this, my heart is with you 100%, and I hope that you're able to do whatever it is you need to do to hopefully fix your teeth, or if need be, get new ones. If you're watching this and you are going through that, I do have a whole series of videos that I made, not so much talking about CVS, but documenting my experience with getting the dentures. Other than that, if there's anything you can do, if it's share this video, post it somewhere. I really want to raise some awareness about this, so hopefully people don't have to go through the same horrible feelings that I have. Other than that, I'm going to quit rambling now. Got a bad habit of doing that. Going on 12 minutes here. Anyway, thank you for watching, and please feel free to leave me any comments, ask me any questions, anything you want. I'm happy to answer them, and hope everyone out there, you guys take care. Thanks for listening.